I'm here in several capacities, one as clinical director for the entire program, but also as medical director for the lung cancer program. And just like I have visions for what the overall program should be, there are certain principles that I want to follow within the lung cancer program here. Central to the program is built on science and the Kimmel science. I think it's important that we are here not only delivering great care, but also offering the best clinical trials for patients and the best novel strategies for patients.
I want to repeat the scan. I want to repeat a CAT scan done here, not now, but in the next 2 weeks.
I would not be doing my job if I were here just in a clinical capacity. I'm here in a research capacity and to bring that Kimmel name and research and my own research to this program and hopefully can benefit patients in this area.
Hi, great to see you.
I serve as the Director of Radiation Oncology for the National Capital Region. That encompasses both Sibley and suburban hospitals. At Suburban Hospital, we provide comprehensive stereotactic and head and neck services, as well as treat a variety of cancers, just as we do at Sibley. And at Sibley, we treat both adult and pediatric cancer care patients. This level of excellence for cancer care is unparalleled in the DC region. I know that any patient that I see, I'll be able to talk to the medical oncologist and the surgical oncologist immediately to provide outstanding multidisciplinary care and a truly integrated effort where we communicate about all aspects of that patient's clinical care and the needs of that patient. Every disease site runs a multidisciplinary tumor board where all of the physicians, regardless of specialty, sit together. That includes medical oncologists, radiation oncologists, surgical oncologists, pathologists, radiologists. We're all together to discuss all the nuances of every aspect of that patient's presentation and disease. We then come together to a consensus to decide what treatment approach to take.
My job as your physician is to be your advocate. My job as your advocate is to balance out optimism and realism. And I've been a lot more optimistic recently than I have in years past. I try to make all my patients aware of A, the research that's going on throughout the country, B, the research that I'm doing, and C, the available clinical trials that they may be eligible for. And I think that in itself instills hope for patients. That Kimmel name, it's a high bar, but I think we're up to the task. We'll have to be ever mindful always of that Kimmel name.
I'm hopeful that it remains negative.
Okay.
I am very hopeful. But I want to kind of show you.
Not only in the care we're providing, but the science and the studies that we're doing here as well. That's a message to the people that I work with. Remember where we're working and what Kimmel is really all about.
Okay, here comes the mask.
The Department of Radiation Oncology was the very first department to bridge from the Kimmel Cancer Center to Sibley. And as a result, we were able to open clinical trials to all patients that entered the doors. Cancer care that's provided at Sibley really is an opportunity to enroll in a clinical trial, any trial that's available at Johns Hopkins. Radiation is available to anyone and everyone in the community. And we have a very integrated cancer care program that includes collaboration between radiation oncology and medical oncology as part of the greater Sidney Kimmel Cancer Center. And that bridge means that we're providing outstanding cancer care in the DC region.
There is fascinating science here and some wonderful physicians that are Hopkins trained or Hopkins employed. Patients have a choice in this area with very good cancer care that weds, great clinical care with innovative science.